Have you had your annual physical exam yet? Today on the show, we'll talk about why you need to mark your calendars and get yourselves checked. We'll also discuss what to expect in this physical exam. I'm Dr. Freddy Gomez, and this is Med Talk Health Talk on CNN Philippines. Getting your annual physical exam is a habit that has value. As we get older, many aspects of our health change. Blood pressure rises and falls, and risk of diseases can increase. By getting annual checkups, you're already taking the first steps in maintaining your health. The sooner you know that you have a condition, the sooner it can be addressed. With us today are Dr. Paulo Miguel Borja, an internal medicine specialist and consultant at Asian Hospital and Medical Center. We also have Dr. Edgar Leuenberger, ophthalmologist at the Asian Eye Institute and president of the Ophthalmological Foundation of the Philippines. Thank you both for joining us. Now, we know that the annual physical exam, or APE, helps determine the general status of your health, but many often choose to forgo this checkup. It could be too nerve-wracking for some, and others don't make the time to get their exams. We need to understand why undergoing an APE is a good thing. So my first question is for Dr. Paulo. What can an annual physical exam actually do for you?
Well, an annual physical examination is a routine, comprehensive, periodic health examination. By the name itself, it should be done annually, or at least once a year. It ensures wellness and good health by monitoring weight, body mass index, blood pressure, and of course, ideally, a full physical examination by a physician. Also, other serological markers or predictors for comorbidity should be measured, such as blood sugars and cholesterol. Ideally, a patient's cardiopulmonary status should also be assessed by doing at least a chest X-ray or an ECG of the heart.
Now, in some companies, employees are required to take a pre-employment health exam like the APE. And depending on working conditions, different medical exams are needed. This could often be intimidating, especially if the exam could make a difference in the hiring process. What does the term fit to work actually mean, and why do companies require this? Dr. Paulo.
Well, Dr. Freddy, the same way goes for pre-employment health examinations. More than just a clearance for work or a fit for work, these pre-employment checks are ways to see if a patient's body can tolerate the type of work that a certain employee is applying for. So each individual body is different, and they will have a unique and individualized reaction to the rigors of this new job that they're undertaking. So they should be assessed definitely for wellness and capacity.
Okay, and another aspect of the APE is an eye checkup. Dr. Ed, why is this kind of examination needed for those applying for jobs?
Thank you, Dr. Freddy. And yes, an annual eye exam is important because, as we know, a productive employee will highly depend on the clarity of his vision. And this is very important for preventive purposes. There are a lot of blinding diseases that can be prevented through early detection. And these diseases are glaucoma, cataracts, diabetic retinopathy, hypertensive retinopathy, or just as simple as getting your eye refracted so that you can get the best grade for your eye, so that you can increase your productivity.
And another common question is, why is it required to declare someone's medical history? At paano ito posibleng makakaapekto sa present health evaluation natin? Still with Dr. Ed.
Yes. Well, the medical history is very important. It's important for the doctor and the patient to know the risk factors for getting an eye problem, such as diabetes or hypertension, or even the family history of going blind. So if you have a family member who went blind from a certain eye disease, the chances of you going blind is also increased. And therefore, it's important to get a very good medical history so we can correlate the findings of your eye exam with your physical status.
Now, Dr. Paulo, is this the same case also for other conditions? Is a medical history that much important, just as probably important as a physical exam?
Well, definitely. As Dr. Ed mentioned earlier, the diabetic and hypertensive retinopathies are also included even with annual eye exams. So definitely with annual physical exams also, it's best to include the CBC, urinalysis, chest X-ray, ECG. These factors that will more or less look at the cardiopulmonary status of this patient, more or less look at the overall balance of this patient. And definitely medical histories, family histories, personal and social history should also be included in there as well.
So many of us these days are anxious and worried because of the COVID-19 pandemic. An annual physical exam is a great way to minimize health risks and at the same time have peace of mind, especially in the workplace. When we return, we'll focus on what to expect when you go for your annual physical exam. From vital signs to blood tests, we'll help you prepare. We'll be right back. This is MedTalk Health Talk on CNN Philippines. Welcome back to MedTalk Health Talk. Earlier, we talked about why we should undergo the annual physical exam. But there are also ways we can best prepare for this. While each exam is tailor-made to fit your medical needs, there's a set of routine tests that you can expect your doctor to perform. Now, Dr. Paolo, let's break it down for our viewers. What can they expect when they go for their APE? What does this include?
Well, of course, like I mentioned earlier, an annual physical examination ideally should include the complete physical examination with a licensed physician. So definitely this is a face-to-face consultation where the blood pressure is taken. Also, the medical history is drawn from the patient. Also, we look at the general appearance of the patient. We auscultate, we listen to the heart sounds, the breath sounds of the patient. Also, we check your abdomen, check for edema, check all extremities, even the pulses. An APE will almost always include serologic markers or blood tests. So that would include your CBC or complete blood count, also a urine test or urinalysis, chest X-ray, and an ECG of the heart. It will also include markers for your kidney and liver status, so like your BUN, creatinine, and ALT. Electrolytes should also be checked, so your sodium, potassium, magnesium, calcium, and in some cases uric acid even, thyroid hormones, and even more comprehensively a 2D echo of the heart should ideally be monitored as well. The fasting blood sugar lipid profile should at least be measured at least once a year, especially for patients 40 years old and above, or those with family history of diabetes and elevated cholesterol and heart disease.
Now, usually during the APE, doctors and patients only have a short amount of time. And some estimates suggest that an average meeting lasts for only about 18 minutes. Now, doctors, how can we maximize this time? What are ways to prepare for the APE? I'll start first with Dr. Ed.
Yes, actually, first of all, because of the pandemic, our lives have been rearranged. And so clinics have also been rearranged to comply with health protocols. So very important that you prepare for the eye exam by calling your clinic, making sure that they're complying, and that you bring your own ball pen and making sure also that you bring all your laboratory tests and know about your history that you brought from previous exams. Now, once you're sure that the clinic has complied with all the health protocols, when you enter the clinic, don't be surprised. A lot of health preventive measures have been undertaken to ensure your safety. And so to prepare for that, you have to make sure that you know your history, you know your family history, your medical history, and if possible, bring a list of medicines that you've been taking. If you're going for an eye checkup, make sure that you have your old prescriptions with you, your old glasses, so that to maximize the consult.
Okay. Now, Dr. Paolo, sometimes fasting or not eating anything for a certain amount of time is needed before an APE. Can you explain this to our viewers?
Well, this relates in particular to the fasting blood sugar and the lipid profile, and in some cases, the whole abdominal ultrasound. This is a way of determining more or less what the basal function of your sugar, your lipid, what the basal levels are. So that it will not be determined by, for example, what was the last meal that you ate, or what was whether it be too fatty or too sweet. That could actually derail these results. So it's better to have at least 8 to 10 hours of fasting for the fasting blood sugar and 10 to 12 hours of fasting or not having any drink or food for the past 10 to 12 hours for the lipid profile.
And as someone gets to the clinic, one of the first things your doctor will check during your APE are your vital signs. Now, Dr. Paolo, what are doctors really looking for, and what do these vital signs say about a person's condition?
Well, it's actually a very quick test, but it can give us a lot of information. For example, the blood pressure, systolic over diastolic numbers. The patients or the laymen always hear this, but it's actually our way of monitoring of whether your arteries or the vessels where your blood passes are actually healthy, eventually leading to your heart, which is actually giving us a more or less a cardiac status of how your heart is. Also, the heart rate that we monitor, we check if it's regular. We try to rule out if there are any arrhythmias, if it's too fast or if it's too slow. Again, to relate to your cardiac condition. Your respiratory rate, if you're breathing too fast, if you're breathing too slow. It will give us an idea of how healthy your lungs are, or if the oxygen level in your body is more or less normal. And finally, your temperature. A high temperature, a fever will more or less correlate to an infection, and in some cases also some abnormal metabolic status.
That's a lot of information to get with those vital signs, so those are really very important things to get. Now let's talk about visual acuity naman. So familiar sa ating lahat ang pagharap sa eye chart when undergoing this kind of test. Why is this being checked, Dr. Ed?
Well, the visual acuity gives us an indication of the health of the eye. And very important that we prepare for that by bringing, again, our glasses. And if we are wearing contact lenses, your doctor might be inclined to remove your contact lenses to complete the exam. Visual acuity is very important because it gives an indication of how healthy the retina is, your optic nerve, and your visual pathways. And it gives a lot of information aside from many other things that we check.
Now, Dr. Ed, can you also further explain what 20/20 vision is? Maraming naniniwala na this is the perfect vision. Is that true?
Yes, actually 20/20 vision traditionally means that we are using the Snellen's chart. It's the chart that we usually see in the Land Transportation Office when we apply for driver's license. It means that what a normal person can see 20 feet away from the chart is what you can see when you're actually being tested. So it indicates the smallest part or the smallest letter on the chart. So it means that you have normal vision, and insurance companies rely on this value when they certify that you are fit to work. For example, you'd like to do some work with the computer industry or IT, or doing graphic design or architecture, or even just going into healthcare, you need to have very good vision so that you avoid errors and mistakes.
That's right. Now we'll take a quick break, but when we return, let's understand the complete blood count and also the best ways to take care of your eyes. Stay with us right here on MedTalk Health Talk. I'm Dr. Freddy Gomez. Here on today's episode of MedTalk Health Talk, we're talking about the annual physical exam and why we should all prioritize this. It safeguards your health from any future conditions. There are many different components to the APE, and it's helpful to know what to expect. We've discussed your vital signs and the visual exam, so now let's talk about the complete blood count and the best ways to take good care of your eyes. Now, as part of the physical exam, your doctor may draw blood for several laboratory tests. This often includes a complete blood count. Dr. Paolo, what is a complete blood count or CBC test? Why is it even ordered?
Well, Dr. Freddy, the complete blood count or CBC is one of the most basic but relatively comprehensive blood tests that your doctor can order. It measures hemoglobin and hematocrit, indices that you measure to detect anemia. It measures white blood cells and differential counts, so it can detect bacterial or viral infections even. It measures several red blood cell indices, which can tell you if you have a leukemia or any other type of blood disorder. The platelet count is also measured to determine clotting and bleeding parameters. So imagine with one simple basic test, there's really a lot of information that you can extract already.
And as Dr. Paulo said, the test measures three basic types of blood cells. These are the red and white blood cells as well as the platelets. Anong posibleng health indicators ng mga ito, Dr. Paulo?
Well, as I mentioned before, white blood cells can actually be abnormal whenever there's an infection. So whenever it's too high, it would correlate to a bacterial infection. If it's too low, it could correlate to a viral infection. There's also differential counts that where we can base it on. So if the segmental count of these white blood cell count is actually high, we really confirm that it's really a bacterial infection. So management will really be based on these counts.
Now, we've also discussed that as you get older, different health issues may appear. And while the APE is an opportunity to refocus on your needs, healthy behavior is needed as well to prevent illnesses. Now, when it comes to our eyes, can you explain the best ways to take care of them, Dr. Ed?
Thank you, Dr. Freddy. The important step that you should take is to get an eye exam when you turn 4 if you're a child, or if you turn 40 if you're an adult. And somewhere in between, the doctor will tell you whether you need to get an annual exam or a biannual exam or an annual or an exam every 2 years. So it's very important that you take good care of your eye by taking that first step. The next step is to, if you're doing some carpentry work, if you're doing some household chores that require eye protection, or you're hammering down nails on the wall or drilling something on the wall, is to wear eye protection to avoid injuries. Very difficult to have an injury now because you need to go to the hospital for treatment. Now, if you're attending online classes, it's very important that you make sure that your eye grade is correct. And what is most important is to rest your eyes every 30 minutes by closing your eyes for 30 seconds. So if you're using the computer a lot and you've reached 30 minutes, close your eyes for 30 seconds, and that will make you more productive and refresh your eyes. The most important thing is to really know your eyes and to know your body, and to make sure that you submit to an eye exam when your doctor advises you to do so. Now, if you have medications and you have eye drops, to make sure that you comply also with those drops. If the doctor advises you to get some specialized tests, it's very important that you also comply so you can help the doctor take care of you better.
Now, Dr. Ed, when it comes to our overall health, eyes included, palaging sinasabi na we always have to have a good and balanced diet. Specifically with the eyes, ano ba ang mga pagkain na masustansya para sa ating mga mata?
Usually, the greener the vegetables, the better. So we're looking at okra, kangkong, cauliflower, kale, spinach. The yellow ones like carrots have traditionally been linked to good eye health, but what is coming out in research is the green leafy vegetables have provided much more protection than the yellow ones.
Very good advice. Now, what are some practical tips to apply to your daily life? Let's start first with Dr. Paulo.
Well, I agree with all the vegetables that Dr. Ed mentioned. Those are not just for the eyes, but good for the heart and the overall body as well. Patients should stick to having a balanced diet, not too much salt, not too much fat, not too much on sweetened drinks or desserts. Focus on inserting ample amounts of fruits and, yes, vegetables in your diet. Definitely smoking and alcohol beverage drinking should be discouraged. And us, your doctors, will prescribe you at least 150 minutes of moderate intensity exercise per week.
All right, and how about Dr. Ed? Is there anything else you could add when it comes to practical tips that our viewers can incorporate in their daily lives?
Of course, very important that you read also what is out there in the literature and you know what's false and what's true. No? There's much information on the internet that are claimed as true but turns out false. So you have to make sure that you know which is which. Now, you have to have a very good line of connection with your doctor and the staff of the clinic. So anytime that you feel anything that bothers you or changes in your vision, you can contact them right away. And not to delay. Many eye checkups have been delayed because of the pandemic, and we cannot afford to lose vision during this time because with widespread unemployment, we need our vision much more than any other time.
Very good. And we can't emphasize enough, while the APE provides personalized healthcare and a look at your body's current state, applying healthy behavior daily is still key to a healthy life. We'd like to thank both our guests for today, Dr. Paulo Miguel Borja, internal medicine specialist, and Dr. Edgar Lundberger, an ophthalmologist. I'm Dr. Freddy Gomez. This is MedTalk Health Talk on CNN Philippines. We'll see you next time.